welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy Podcast Studio. And our guest could not make it today, so we are going to be talking about heart health and brain health, and how they're related. So, Janet, I'll let you go.
This is extremely important, I think, in our society today because Alzheimer's and dementia is just rampant in our country, and also brain fog. I think for many women and men as we are aging. Really, as an organism, as a human, we are interconnected. Our whole body is not just a box, and we separate the brain and the heart and the liver and the kidneys and your muscles, and we are all interconnected. So I think that's where we need to start, is that there's a direct relationship to all of our organs and our brain as to overall health.
Yeah, and a good example is we've known for years that um, if you have bad oral health, you are likely have cardiovascular disease. So people with gum disease likely have more cardiovascular disease. So we shouldn't be surprised. Why is that? People with gum disease have a lot of inflammation. There's a lot of inflammation going on. So that also, just like Janet says, it goes over the entire body. So there's many people I've seen that their teeth are rotting out, their teeth are falling out, and they have cardiovascular disease. We shouldn't really be surprised. In medicine today, we have all these specialists,
Mhm.
whether they be urologists or whether they be pulmonologists or whether they be cardiologists. The list goes on. But the reality of it is that all those things are interconnected. So if you have a nephrologist that deals with kidneys, um, most of your kidney function comes from your heart and how your heart pumps. So really, in reality, um, you should look at a body as a whole instead of just partializing things, because that's what I call a lot of specialists is they're partialists, um, because they look at a partial part of the body. They're not just specializing; they're partialists, and they should be looking at the body as a whole. So um, that's what we try to do when we talk to patients and we think about overall health. It's really not that complicated. We make it more complicated than it really should be. We really need to make it simple. And healthy heart, healthy brain. How do you have a healthy heart? How do you have a healthy brain?
So, we probably beat a dead horse here, but super important. Lifestyle trumps everything. So if you're not sleeping correctly, if you're not eating correctly, and you're not exercising, um, that puts you at risk. And really, in our country, it's really sad because at least 70% of us are overweight. 50% are at least obese, and the statistics for our children is staggering as well. So it's a lifestyle issue. It's not just genetics. I mean, people want to fall on that sword, but I'm not buying it. Um, you need to really look at your lifestyle, and it starts with sleep, food, and exercise. And one of the things that I take as a pearl from my mother is she was a geriatric nurse for nearly 30 years. And she always said the oldest people in the nursing home or the assisted living home were the people that had the less meds and were always busy and moving. There's some truth to it because when we stop moving and we start just becoming sedentary, it compounds the issue. And where I'm going with this is that anytime we have chronic illnesses, it comes down to inflammation.
Absolutely. It talking about medications and longevity. I remember I was doing in pharmacy school over 30 years ago. I was doing my rotation in a long-term care facility, and I was following this patient, and she was 88 years old, and she did have dementia, or slight dementia at the
Mhm.
time, and she was on no medications. And I asked my preceptor, I said, "How could this be? This lady's 88 years old, and she's on no medications." I said, "I think something's wrong. I mean, are they not telling us? Am I missing something in the chart?" And my preceptor said this, which I think it's also interesting. My preceptor had been in pharmacy a long time. Let's just say that, for decades and decades and decades. And she said this. She said, "No, that's probably right. Think about it, Shawn. If she was on medication, that means she has chronic disease, and she'd probably be dead by now." It's like, whoa. That was kind of surprising as a young, I wasn't quite a pharmacist yet. I was still an intern. It was like surprising on me. And now I think about it, it's like, totally. So guess what, people? Medications do not increase your longevity at all.
No.
In fact, I am going to say that if you are on medications, the traditional high blood pressure, high cholesterol, diabetes medication, it is shortening your life. Not necessarily just because of the medication, although I don't believe those medications increase your longevity at all, and they do decrease they increase your morbidity because they all have side effects. Let's just call them what they are: toxicities. They're toxicities because they are poisons. So the less you can be on them, the better you'll feel, and probably the longer you'll live. That being said, the reason you're on the medication in the first place is because of your lifestyle, like Janet was talking about. So the way to change that is not take a magic pill that's going to lower your blood pressure, or a magic pill that's going to fix your reflux. Your issue is you need to change your diet and lifestyle.
Let's face it, we live in an insurance-driven healthcare system. No doctor out there that is being paid by your insurance is going to talk to you about food and exercise, because you don't even have a decent amount of time to have a discussion with them when you go in for um, an appointment. So the only thing that they do is check the box on their computer screen as to what they're going to prescribe for you, which to me is totally sad, because we know anything that we take from big pharma or from the pharmaceutical end has side effects. There's nothing out there that we can give you that doesn't have side effects. And if somebody tells you that, that's a lie. It's a blank out, full out lie. They are either misinformed or they're telling you the biggest scam out there. So let's be reasonable. If you have something that you are doing every day that's going to impact your longevity and your overall lifestyle or overall enjoyment of life, you know, we need to address it. And there's many things that we can do. And many times people become very overwhelmed when we talk about lifestyle, but really start where you are and build on it.
It's really that simple. So back on the heart health and how it relates to brain health is, I saw an episode, just a quick clip on Dr. Peter Attia,
Mhm.
and I follow him on social media, and I agree with most of what he says. I don't like the fact that he still believes in statins. I believe statins are, statins that lower cholesterol. I think we've been scammed with the whole cholesterol thing causing heart attacks. Um, and but he did say this. He says, he quotes a lot of studies, and I'll tell you this: I'm skeptical of studies. I, I I just don't buy or believe most of the studies, because, and for those of you that have woke up during COVID and you realize how many of the studies are flawed, that's why I don't believe the studies. I just think rational about it. So he said there's a big study on heart health and brain health being related. It's like, well, like Dennis says, we shouldn't be surprised.
No.
I mean, if you have a healthy heart, you're gonna have a healthy brain, and vice versa. If you have a healthy physical body, whether you have lean body mass, low body fat, things like that, you're going to have a healthy body in general. So there are some ways that we can test for inflammation, and people ask me that. It's like, well, what are some of the best tests for inflammation? First of all, I always like to go back to just being reasonable and rational. And Janet already talked about insurance companies and how they have hijacked medicine. And what that means sometimes is that the healthcare system has, does unnecessary tests, unnecessary imaging, unnecessary surgeries just because somebody else pays the bill. That happens all the time. I write about in my book, Sickened, how the government ruined healthcare and how to fix it. I write about how, 85% of all procedures that are done in healthcare, procedures, tests, imaging, are unnecessary. Um, and it's really just promoted because somebody else is paying the bill. So, but what are some of the tests if we did want to order some of the tests? And I had mine checked a few years ago just to see. But if you follow me enough on social media, you know I don't chase lab levels anymore. I'm not a big believer in chasing labs because I know where I'm at now. I know I'm healthy, and as long as I don't change what I'm doing in my lifestyle, my labs aren't going to change that much. So some of the tests are C-reactive protein. It's a marker of inflammation. And ESR or SED rate, they call it, is another marker of inflammation. You want both those markers to be low. I don't know the numbers right off the top of my head, but just realize that there's a range and you want it to be on the low end. Those are lab tests, but I will tell you the most important test is the meter test. Um, Jan and I see it all the time. You know, when we go out and we see people, we're like, oh man, that guy's a walking heart attack, or that guy's really inflamed, or that lady does not look very healthy. You can just see it. You can see it in a person's color. You can see it in their overall body composition. You can just see it. It's no different than what veterinarians do all the time with animals. They don't need to do some fancy MRI or some fancy blood test to say, "Wow, your dog is sick. What have you been feeding it, Janet?"
So if I was going to recommend for someone to look at labs, if that was important to them, and this might be okay to look at. Like he said, C-reactive protein, but I also think insulin might be a good one to look at. Because if you are not responding to your natural production of insulin, it means that you're resistant to the glucose that you're consuming, and that's going to come down to carbohydrates. Carbs are things that in our society that are really overused. So we're talking not things that rot. Like I'm not opposed to vegetables and fruit. I'm not total 100% carnivore in my life. However, if you are eating processed and foods that have, tons of ingredients on them, you should probably stop, especially if you have high insulin resistance. If you're not responding to your pancreas releasing insulin in your body, you're causing inflammation everywhere. Every cell in your body is upset. That's your vessels, that's your lungs, that's your heart, that's your kidneys, that's your liver. I mean, everywhere. So, food is super important. So, if that's the case, then we really want to address it with lifestyle choices in our food. And Shawn and I beat protein and fats over and over again because when we were going to school, we were taught the exact opposite: low fat, low protein, and high carbs. And look at where we are today. Yeah.
Well, and also when we were taught in school, if you
Yep.
did eat fat, you were supposed to eat vegetable oil.
Right.
You know, don't eat lard, don't eat
No
saturated fat,
animal.
no animal related fats. And how's that been working for us the
It
last 40
hasn't.
years? Not very well. And
Mm-mm.
how did animal fats and animal proteins work for humans 3, 4, 5 generations ago? Yeah, there
Right.
was no obesity and they thrived.
Right. And let's be really honest. Breast milk is full of cholesterol. Full of cholesterol. We require it to develop our brain. It's required for our brain health. So now we are at this point where we've been giving our society for 30, 35 years. I call it vitamin statin because it's just like it went
Ubiquitous.
explosion
Everybody's on it.
everywhere. You ask people what they're on, statin, 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 and it's like, are
Oh, but
you
it's a low dose.
kidding me?
Low dose of
You're
poison.
killing your brain cells because you're not replacing and building new brain tissue. So that's a problem. And then we added on top of not having good cardiac health. So we're depriving our brain of the oxygen it needs because if you have a healthy heart, it's going to get the oxygen it requires. And then we added on top big pharma, which decreases the cholesterol that your brain needs to rebuild tissue and be healthy. So now we got two markers. And then if we're sedentary, we're not moving the oxygen like we need to.
And that's just her using the example of cholesterol being high in breast milk is just another example of how ridiculous thinking cholesterol is bad for us. So you're telling me that we were designed to live for months off breast milk alone, and it's high in cholesterol, and cholesterol is bad for us, I'm not buying it. I'm not buying the cholesterol thing. Um, so, you know, those are things that you need to think about when we're just think rationally about these things. I like to say that I'm not a scientist. I'm not a smart individual. I just want to think rationally about my own health and give that information to others. It's really, really doesn't have to be that difficult. I think the healthcare system tries to make things more difficult than it
Sure.
really is. They want to confuse people, just like they confuse people with pricing. They're not transparent. There's all kinds of surprises. They do that because then it's easier to hoodwink people.
Well, that comes down to the insurance part of it and big
Exactly.
pharma. But so, if you've been listening to us long enough, you know that we specialize in hormones, and there is a valid point to be made that hormones play a huge role in our longevity and our overall health. And where this comes to play, especially with the heart, is hormones play a role in the integrity of the vessels in our vascular system. So if we're not taking care of that, there's a problem. If we're not exercising, that's a problem because the muscle's not strong. So, it all plays together as a puzzle, pieces put together. You can't have just one and not the other. You have to work in all things. But, I think when we look at it as an outsider and we're not in healthcare or you're not a pharmacist, doctor, or nurse, sometimes we make things a lot harder than they are. So that's why we keep coming back to the basics. You need to exercise, you need to eat well, and you need to sleep well. And those things make a huge change. And so when I'm counseling people about, making lifestyle changes, start with one thing. Start with maybe two things. Make it simple. Eliminate things as you go along. And then, you know, be celebrating the fact that you've achieved that and you can move forward. We all know what we do in our life that probably needs to be improved upon, but make a goal, write it down, tell the world, and work towards it. And I think that's the approach we need to go for rather than some prescription that's a foreign chemical that we're putting in our body. And I'm not saying there isn't a place and time for things to help us maybe in a crisis. But I think for every day, if we're going to have a healthy heart and a healthy brain, we need to do the things that make us healthy on a day to day basis.
And sleep trumps them all. Sleep is the most important. If you're not getting at least 8 hours of sleep a night, that's a problem.
Mhm.
We've done podcast specific episodes on sleep. Um, and, one thing that's important is the consistency, the length of your sleep, how often you get good sleep, the quality of sleep, those things. So it's not just laying in bed for 9 hours, but
Yep.
you should be sleeping for most of that. And really, when you teach your body that you have a regular bedtime, you go to bed at the same time, all largely within an hour or of each other, and you get yourself on a pattern and you get up at the same time most of the time, then it makes it easier. And here's another one. We are made to sleep during the night and work during the day. So, for shift workers that are having health issues, I recommend that you, you stop shift work. Um, I think shift work is one of the most harmful things that has happened to um,
Mhm.
our bodies
Society.
in
Mhm.
our society is it literally kills people. We had a podcast with Rob Wolf, and he talked about sleep, and he talked about a study that showed that sleep is one of the lack of sleep and working at night specifically is one of the biggest causes of cancer. Why is that? You say, oh, that's ridiculous, right? But
Mm-mm.
why is that? Our immune system recovers at night when we should be sleeping, and if we're not, we don't recover. And what does that mean? That means anytime we're hit with any kinds of cancer causing agents, any kind of carcinogens, which we're bombarded with them all the time, our immune system is not strong enough to fight them off. So um, if you're having health issues,
Yeah.
sleep at night, work during the day.
So another plug for sleep is REM sleep is super important, and the reason it is it also helps clear our mind. It's like there's only so much information, so much stuff that we can handle as a human at a certain point, and when we go to sleep and we're in our REM, it takes care of that. It shuffles through it, clears it out. It's kind of like, you know, kind of the screening tool of what's important and what's not. And people that have lack of sleep don't think as clearly. Um, they make less choices that are probably better for themselves. I mean, I think about the times in my life that I'm exhausted. The choices of food, the choices of, what we choose to do or not do is totally different than when we are in a state of total relaxation or woken from, good rest. Um, and that includes your muscles, that includes our heart, that includes, so many different things. The other point I want to talk about is people that have healthy heart and healthy brains also, they utilize going out into the outdoors. I mean, that is something that we forget to tell people to do. There's a lot of therapy with that. I mean, Shawn and I Friday went on a drive and we went through the mountains and saw the trees and all the changing, and we were outside in it, spent as much time as we could over the weekend outside. Well, there's something different that happens with the exposure of being outside. I mean, moms know that for years. I mean, that's why we took our kids out to wear them out, right? Get them outside, make them run, be out in the environment. But there's part of it that we were made to be a part of that makes a huge difference. And I know some people, their lifestyle, you're in a city or you're in, a country, but choose to have some outdoor activity because that makes a difference as to, you know, being restful and being able to go to sleep. There's a therapy in it, being exposed to the breeze and the smells and enjoying life. I mean, make a point to do that in your life because I think mental and emotional health brings on a different picture when we do that.
Yeah, absolutely. There's so many things that happens when we go outside that most of them that we don't even realize, but all kinds of neurotransmitters are produced in our bodies. We know about sunlight and vitamin D, and how vitamin D is a antidepressant in itself. So it is, nature therapy is very, very important. We were created to be outside, and at least during most of the day. So if you want to be healthy, you will be outside doing an activity.
Mhm.
Um, it doesn't have to be that complicated.
No,
Just think about what we did, thousands of years ago, or even hundreds of years ago, what our ancestors did. It wasn't sit inside and watch TV and drink beer and eat Cheetos. No, it wasn't that.
no.
It was walking most of the day and in some form, and they were outside.
Mhm. A body in motion stays in motion, and that's something I've pulled on for many years. And also, we had a podcast guest, I think early on in our episodes, talking about how small changes make big door swing, right? So
Small
small
hinges
hinges make
swing big doors.
right. And think about that. If you're just focusing on a few things that you want to achieve at a time, before you know it, you have it. Whether it's I'm going to walk, and you don't have to make it. Don't make it this huge plan. Just make a few things and step forward, because we know that all mortality, all disease states are affected over time. All mortality rates go down when we exercise and move.
Yeah, there's no doubt about it. And sleep right, and
Right.
of course eat right. So, Jen, if you were gonna say one thing about eating, what would it be?
So the American diet is full of processed foods. Get
What's a
rid of
processed food?
anything that's in a box or doesn't rot. So I'm not opposed to like maybe dried foods and hydrate them and but just focus on fresh. If it rots, eat it. If it doesn't rot, avoid.
Yeah, I mean that's a good tip. If bacteria and fungus won't grow on it, then how's it going to assimilate into our bodies?
Right.
That's a pretty good point. I want to go back on the labs a little bit, and Janet talked about fasting insulin. If there is one, I believe if there is one test that you can do, most doctors don't do these tests, but if there's one test that you can do to see your overall health, I think it's fasting
Yep.
insulin. It is better than glucose. Blood glucose, high blood glucose is typically associated with diabetes. But many people glucoses will be normal, and yet their insulin will be high because their pancreas for now is keeping up, but it will diagnose diabetes probably 10 years before your glucose gets high. So fasting insulin is probably one of the most important tests for overall health in general. And another one would be triglycerides and HDL. It's part of a lipid panel. Janet, you want to talk about triglycerides and HDL?
Well, usually HDL is considered what we call the good cholesterol, and really what it is talking about is what's being cleansed out of our body. Our liver needs to excrete and get rid of. So if you have a low HDL, you're not eliminating very well. And usually if you have high triglycerides, it's indicating you're in inflammation. It's not that we don't need triglycerides, we do, but the higher that level is, it's a marker of inflammation and we need to change that. So again, lifestyle is an important factor in doing that.
And it can be a mark. It can be
It's a
just a
marker.
marker. And it's largely a marker of, poor diet also, and you're just not processing your lipids appropriately.
Yeah, your liver's not working like it should.
Your triglyceride HDL ratio is very important. Well, that about wraps up our podcast for this episode. Stay tuned Thursday, 8 a.m. to 9 a.m., our midweek podcast. Thank you for tuning in to Health Solutions with Shawn and Janet Needham. Thank you.